Hello, I'm Dr. Bill Wagoner, Chief Dental Officer of New Smile Crowns. Thanks for joining me for another Tuesday tip. Today, I'd like to talk about improving retention of crown preparations for zirconia crowns. First, if I've prepped a tooth for a zirconia crown and I have successfully fit a trying crown, the last thing I do before cementation is to rough up the surface of the preparation, which is going to increase the surface area for the cement adhesion, and it's also going to create some mechanical undercuts to engage the cement. I may use my tapered diamond burr or a quarter round burr to make small horizontal or oblique cuts across all the surfaces of the preparation. In my opinion, this really should help lock the cement onto the tooth. I think it makes sense to do this on both anterior and posterior zirconia preparations. If you've had to perform pulpal therapy on a tooth to receive a zirconia crown, there are also some tricks to potentially improve retention there. If you've done a pulpectomy on an anterior tooth, you can remove approximately 3 to 4 millimeters of the paste from the coronal portion of the canal. I will usually use a number 35 or 37 slow speed inverted cone to remove paste and create an undercut in the canal. This space can then be filled with a resin modified glass ionomer or a composite to create a core and build back part of the destroyed tooth structure. Once again, after you've prepped and fit the trying crown, you can be even more aggressive in your creation of mechanical undercuts. I'll often use a 330 burr to make a through and through hole in the anterior crown prep. Now, when the crown is cemented, the cement that's inside the crown will flow into that hole and should really lock the crown onto the tooth, anchored by the core. Although we would rarely need to do a core in a posterior tooth, if you've done a pulpotomy, you can still use a 330 burr and punch holes from the buccal and the lingual in the middle third of the prep into the pulp chamber, which is now filled with IRM or MTA. Just like for anterior teeth, there are now holes for the cement to flow into and lock the crown onto the preparation. Now, as a disclaimer, these are techniques I've developed and that I've used, but to date, no one has actually done any crown retention studies to see if these suggestions actually do aid in retention, but they make sense to me. So give it some thought, maybe give it a try. In the meantime, thanks for watching, and I'll see you next time on Tuesday's Tips.